Hello, my name is Jose Miranda Velasquez, and I'm going to demonstrate the tracheostomy care for BSN 266. We want to ensure that we have the provider's orders for this patient and the trach care. Once out, we're going to start by entering the patient's room. We close the door behind us to ensure patient privacy, and then we perform hand hygiene. I introduce myself to the patient. Hello, sir. My name is Jose. I'm one of the nurses here. Can I have you please state your name, your date of birth, and the medical record number if you know it? Perfect, and we'll verify that with the wristband, as that is 2 patient identifiers. Okay, Mr. Miranda, today we're going to be doing some tracheostomy care. Is that okay? Okay, all right, so we're going to go ahead and get started. We're going to raise the bed to a good working height. Then we're going to place the patient into a Fowler's or semi-Fowler's position unless contraindicated. At this point, we would assess vitals and then place a pulse oximeter, which on the patient's finger, which should remain during the duration of the procedure. Before we get started, I want to pre-oxygenate our patient for at least 30 seconds. And then at this point, I would suction the trach tube if it is necessary. I would then apply clean gloves. Remove the oxygen source. And then I would remove the soiled trach dressing. I would then remove and discard the gloves as well. And perform hand hygiene. At this point, I want to set up our supplies. They are open. I want to open it up. Pull out my sterile gloves. And then pull out my sterile dressing field using the 1-inch border. The shiny part is the part that's on the underside. It's the only part that I can touch that would go down. Okay, we're going to take our tray and empty it into the field. Take our tray. We're going to pour our soaking solution of sterile normal saline into the container, and then one of them is going to be the peroxide cleaning solution. At this point, we're going to don our sterile gloves on. Using the 3-finger method, I'm going to 3-finger and pick up here. Then I'm going to scoop. Okay, discard my paper. Ideally, I would ask for another nurse or a nursing assistant if they could come and help with the procedure. I would task them with stabilizing the trach so it doesn't fall off or become dislodged. We want to go ahead and organize our tray. I would go ahead and then place the Q-tips into the saline. Once I start touching the patient, I'm going to use one hand for the cleaning, the other hand for the patient. We're going to unlock the inner cannula and then remove it with the curvature of the trach. And then we're going to place it into the soaking solution. I'm going to grab our brush with the sterile hand and clean our inner cannula and scrub it and place it into the normal saline again and let it soak. Okay, I can discard that. Okay, I'm going to pull out, and then I'm going to dry it or let it dry. Once it's dry, I will then go ahead and replace the inner cannula using the curvature and secure it back into place. Okay, then we're going to be taking our Q-tips that have been soaking in the normal saline and clean around the stoma. Then we're going to discard that. I'll take another one and clean the faceplate. Discard that. Then we're going to clean around the trach. We want to clean around the trach and get the all the excess flange. I'm going to discard that. If I need to, I can take gauze and do some pat dry. At this point, we're going to change our trach ties, and we would ask for 2 people or for assistance for a 2-person task. So at this point, I want to carefully change the tie. Okay. Assuming that I have the 2 people, I can let go of the trach. However, if I am by myself, the idea is that I don't let go of the trach. For the video purposes, I'm assuming I have 2 people, and just so that I can work the tie, because the tie that the kit came with was taped to the back and required 2 hands to free. Additionally, this kit only came with the 1. So we're going to use our 1 tie, pass it around the back, assuming my assistant's still holding on to my trach as I would want, and it is in the place and not shuffling. And then I'm going to pass it through the other hole. At this point, before I do my tie, I want to come around the back and ensure there's no twist on the tie itself, or the no twist or anything that can cause skin irritation or skin breakdown. I want to make sure it's on securely. And then I will tie the knot. At this point, I'll check the tightness of the tie, and I want to have the 2-finger width to be able to stick my 2 fingers through. And again, assuming my assistant's holding on to the trach. So I can fit 2 fingers here. And again, we want it snug, but we don't want it too tight to cause discomfort to the patient. At this point, we'll replace our trach dressing. Okay, and then I would want to take a 4x4 and then place this under the tie portion where the knot is, so that it doesn't create a tear on the skin. These excess pieces of string, of tie, I can cut if need be, and then just go ahead and place the gauze over that tie portion and make it look nice and presentable. If need be, I can add a piece of tape, and then the tape goes on the 4x4 itself, not on the patient's skin, and that is to provide comfort. At this point, we would clean up our items. We would replace our patient's oxygen, place them in a position of comfort. I would want to ensure that the bed is in a low and locked position, and I want to ensure that the call light is within reach. I will discard the remainder of our supplies, remove my gloves, perform hand hygiene, and then go and document our procedure. Thank you so much. That is it.